I had a lateral brow lift that I had done, and I chose to make EO2 a part of my recovery program. So both physicians, I went to two different physicians. They were not opposed to me using CDO therapy. They just didn't necessarily buy into it either. And so it was fun to be able to do it and to be able to show them the remarkable difference that I had with it. And so I wore it 15 mLs of oxygen, and I did wear it 24 hours a day. I did not take it off. So this was 2 days post-surgery. I had minimal bruising and no pain. Honestly, 0 to 10, zero pain. I did not have any pain from the surgery at all. And that was 10 days post-surgery. So staples out, sutures out, 10 days post-surgery, which is pretty amazing. 3 months post-surgery, you can barely see that faint line. I feel like for me, in seeing other people who've had similar surgeries, my scarring is significantly better, quicker with this. Okay, so then my other surgery I had was a pretty intensive abdominalplasty. I had umbilical hernia and diastasis recti. Again, my twins and my 5 children were not nice to my stomach. So I wore the EO2 24 hours a day post-surgery, same, the high level of oxygen, and I had that on continually. And in fact, my surgeon was awesome, and he applied it before he wrapped me and put my binder on and everything else. So it was on immediately after surgery.
Is that 2 different ones?
I did. I had 2 on there just to cover the entire abdominal area.
So you needed 2 of the fuel cells.
I did. Yeah. And I did the same thing on my forehead. However, after having experienced that, I would have done 1 with a larger dressing.
I see.
I had 2 with the smaller dressings, and it was almost just too many cords and things hanging off of me all at once, that I learned after about a week, once I was up and moving around, that I was like, all right, 1 dressing is easier. Okay, so typically abdominoplasties are pretty intense pain-wise, especially when you're doing muscle repair and everything else. I was off pain meds in 4 days. Did not need them at all, was completely off pain meds. I walked into my post-surgery appointment a week later, and my surgeon actually happened to be in the waiting room and did a double take when I walked in, because I was walking standing up straight, just walked in, and he looks at me and he's like, "Are you being good, Rechelle?" And I was like, "I promise I'm being good. I'm staying in my rocking chair. I'm not moving. I'm being good," because I felt good. So he wanted to make sure I was being good. I had, again, minimal bruising, minimal swelling. My incisions were healing really, really quickly as well. And that was 3 months post. Great collagen stimulation, and you can see my scar down low. Again, it's very, very fine, very thin. I actually and I don't have the slides for this, but I actually had to go in for a little bit of a repair. So if you look, there was a little bit of puckering happening. And so he went in and did a little bit of repair there back 1st of January. And my scar from that looks amazing as well. I used EO2 for that as well. And I never even had to take a pain pill for that one. I didn't need it at all. So I think for overall being able to have something that's wearable, that you can take with you, that's easy to use from a consumer standpoint, it's not complicated. It's very, very user-friendly. The fact that I was able to heal those scars so well. I have patients who had abdominoplasties months before mine, and my scars look significantly better than theirs. So I think that ability to have that full wound healing and that oxygen to create that neocollagenesis is amazing. And then, as you pointed out, the cost effectiveness and ease of it. If you're able to spend thousands and thousands of dollars on surgery, being able to have wound care to maximize those results and to have optimal wound healing, to me is absolutely necessary. Why wouldn't you do that? So I definitely think that having that was a huge part of it. And both of the physicians that saw the results and saw the wound healing afterwards were amazed. Both of them were just like, okay, give me the information on this. I need to look into this a little bit more. So it was good.